Now, such earning potential has actually created a problem in itself. To be a nursing educator, instructors need both practical experience and the necessary credentials to take on such a role, which often includes graduate level education and graduate level tuition. Our Russ Joel shows us how the Oklahoma Healthcare Workforce Center is helping to bridge the financial gap.
What would be some reasons that your patient would be hypoglycemic?
Christy Boswell teaches nursing here at Tahlequah's Indian Capital Technology Center. And while that may not seem newsworthy in itself, consider this. If Christy wasn't able to teach, these 8 students wouldn't be able to learn. And if these 8 students were unable to learn, there would be 8 less qualified nurses to fill over 1,000 vacancies in Oklahoma. Nurses need educators. And for this educator, she needed a boost to get the credentials necessary to train tomorrow's nurses. She needed a Penn grant.
The Penn grant helped me personally by obtaining my master's degree. I always had a goal that I wanted my master's degree. I just didn't know I would achieve that at this time in my life.
A dream come true not only for Christy, but her students as well.
The Penn grant helped me professionally by giving a knowledge base and a great rationale of why we use theory, frameworks, and evidence-based practice in the education system.
Penn is short for Partners Investing in Nursing, and the grant provides scholarships for current nurses to attain the graduate education necessary to become nurse instructors, augmenting the reach of their knowledge and experience.
I think what I found most valuable in my experience was the great educators that I had throughout the program who had years of nursing experience.
While nurses are no doubt invaluable additions to a hospital staff, the value of their experience in a classroom is even more so. In fact, for every 1 nurse who becomes an instructor, they're able to train 8 more nurses, exponentially increasing the supply of workers to a profession in need.
One of the greatest things that the Penn Grant has offered to us is that it's been able to assess the problem comprehensively by involving government, educators, and healthcare providers.
Brian Woodliff is CEO of Tahlequah City Hospital and says the grant has not only bolstered his nursing staff, but also augmented the leadership skills of his supervisors.
Because of the dwindling healthcare workforce, we've had to ask our best clinicians to be managers. And the distance learning program that the Penn Grant has offered us has been able to fill that gap for us. And now our clinicians that are great have been able to take advantage of this and meet that competency and make the transition to leadership.
And what does the book tell us for normal blood glucose ranges?
And for teachers like Christy, taking on her new role means giving back to the profession she loves.
I always knew I wanted a master's, so I'm happy that I did complete that task and goal for myself, and I also hope that I can give back to the profession that has given me so much.
A profession made healthier by its educators.